All right, good morning, good afternoon, or good evening, depending on where in the world you're joining us from. Welcome to the Harari Institute for Computing at Boston University. My name is Eric Kalachik. I'm the director of the Harari Institute. And today's event, we're very happy to co-sponsor with the BU Institute for Sustainable Energy. I am going to just do a brief introduction here, and then we'll get on to the main event. For those who aren't familiar with us, the Harari Institute for Computing at BU is dedicated to leading integrated initiatives in research and technology development. We target a broad set of disciplines at the nexus of computing and data sciences. We have core strengths, as you can see here, in areas like cloud computing, security and data privacy, and artificial intelligence, as well as a network of over 300 research affiliates across a vast spectrum of disciplines. Harari Institute can definitely be said positively impacting people everywhere. Here's a quick look at the agenda for today. I'll give these brief comments, and then I'm going to turn it over to our host, Aisha Walcott-Bryant, and then we'll have a talk by our speaker and followed by some Q&A. We've asked our speaker to prepare about 35, 40-minute presentation. That'll be followed by 15, 20-minute Q&A. We're going to ask those who have questions to please enter them in the Q&A feature of the Zoom. And then all questions will be held for the Q&A portion of the event at the end. This is what the Distinguished Speakers Series looks like. We're pleased to have Claire Monteleone speak to us last week, and today we're delighted to have Aisha Walcott-Bryant speak to us. We'll also have Francesco Fusonarini speak tomorrow, and then we're going to have them all join us again for a panel discussion. So the Harari Institute Distinguished Speakers Series brings up and coming and high impact speakers with bold ideas in computing-enabled, data-driven areas of research to BU, either virtually as today or literally. These take place once per semester, and the series hosts a handful of speakers, as you can see here, clustered around a common theme over roughly a 2-week period. And each of these are giving a talk of their own, and then they're reconvening around the panel. This series' specific mission is the following. Humanity faces the defining challenge of learning to prosper within the ecological limits of the planet. Artificial intelligence and machine learning offer powerful new tools that could open new paths for humanity to embrace sustainability. This series is really seeking to bring together leading thinkers at the intersection of sustainability and AI. I do want to mention this series is led and organized by our junior faculty fellows at the Institute. I'm really delighted that they're excited to do this. I'd like to thank in particular the following junior faculty members for their efforts. Garrett Johnson, who is Assistant Professor of Marketing here, Aisha Walcott-Bryant, who we have with us today, who's our Assistant Professor in the Department of Electrical and Computer Engineering, and Scott Hurst, who's an Assistant Professor of Law. Again, just flagging the panel for you, right? This is Friday, 11 a.m. Eastern time. We're going to have all 3 speakers coming back and join us. We have found that this is perhaps, if anything, even more fun for the speakers than the speaking itself. And you can really see it. So these panel events are really something to attend. All right, and let me introduce today's host, and then I'm going to turn it over. So Aisha Walcott-Bryant is an assistant professor in the ECE department here at Boston University. Previously, he was a Humboldt Fellow at the Max Planck Institute for Intelligent Systems and a postdoctoral fellow at Carnegie Mellon. He received a BS degree in math from UCLA in 2010, an MED from UCLA in 2011, and a PhD in ECE from UCSD in 2017. He won the 2017 Best Dissertation Award for the IEEE Intelligent Transportation System Society and a number of different Best Paper Awards, as well as now organizing several workshops. Aisha, it's all yours.
Great, thank you so much, Eric. I'm very excited about our talk today and introducing our featured speaker for today, Aisha Walcott-Bryant, who is a senior technical staff member and research manager at IBM Research Africa, Nairobi, Kenya. She leads a team of phenomenal, dedicated research scientists and engineers that use AI and cloud and other technologies to advance the state of the art in the future of health and climate. She has a strong interest in developing AI tools for to accelerate discoveries in healthcare and beyond. See some of recent work on COVID-19 interventions at ibm.github.io/WNTRAC, and working across sectors to create innovative, sustainable AI solutions to transform emerging economies. Aisha is also a program co-chair for ICRA 2022. Aisha earned her PhD in the Electrical Engineering and Computer Science Department at MIT in robotics, as a member of the Computer Science and Artificial Intelligence Lab, CSAIL. Before we get started, I wanted to remind folks to follow the Hariri Institute channels to get latest updates on upcoming events. Today's talk will be recorded and posted to the Hariri Institute's YouTube channel. Thanks everyone for attending and joining us today. And please welcome Aisha.
All right, you can hear me and you can see slides. Let me put them on full screen. Okay, so you're seeing the right view?
Yes.
Excellent. All right. Well, thank you for that excellent introduction. I really appreciate the opportunity to be here with everyone. Today, I'll talk about, actually, I'll focus more on the global health space and how some AI methods that we've been leveraging and innovating from have been helping to address some of these global health targets. And what's interesting about this experience is that we leverage our local context, which is the African context, data sets, partners, and collaborators from the continent in order to develop these innovations and to look at some of these problems in a different way. So that's what I'll discuss today. It's more of a breadth discussion of where various AI methods can be interesting and insightful in the global health space, just to kind of give the audience an idea, various ideas in terms of where AI can be applied. So just to give a little bit of background, I know they did a bio, but kind of how did I land in Kenya? I get that question a lot, so I'm doing a preemptive on that. So I was born and raised in Maryland in the USA. Growing up, pretty normal childhood, really enjoyed computing and electronics, but also, played sports and things. I definitely enjoyed building little robot kits and all of that. And eventually I applied to, various schools for undergrad, including Clark Atlanta University, and had the pleasure of doing my undergraduate in computer science at Clark Atlanta University. I then later pursued a PhD in robotics at MIT. But while I was at MIT, I had the interesting opportunity to work on 3 projects, 2 of them in Ghana and then 1 of them in Kenya. And this is kind of, it kind of motivates my story in terms of, doing robotics research, which I just love naturally, and then having this new opportunity to see how various AI methods and technologies can be leveraged in a very unique and innovative space. So in Ghana, I was teaching computer science and entrepreneurship. I also helped to deploy the first Fab Lab, so that's digital fabrication like laser cutters and all of those type of digital fabrication tools. The very first one on the continent. And then I also had the opportunity to work on incorporating IT into an education curriculum in Kenya. So after MIT, I actually wanted to be abroad in general. I had the opportunity to work in Spain. I worked in Spain for about 2 years, and as soon as I saw an opportunity to conduct research on the continent of Africa, especially from a private sector perspective, which I find interesting when you think about sustainability. I basically raised my hand, and as it turned out, it was my old internship advisor who had opened the lab on the continent. So that kind of lets you know how the network works, and to do a really good job for those of you who have internships, because it matters. And so then I joined IBM Research Africa in Nairobi, Kenya, where I live currently. And I've worked on a number of projects from, most recently in COVID-19 to water management projects in the more semi-arid and arid areas of Kenya, to mobility, addressing traffic and transportation in developing cities, and many others. So very happy to have had this experience and to continue it. So just to give some context to kind of frame, the thinking and the environment. So Africa has over 1 billion people. We speak over 2,000 languages, and there's more than 3,000 ethnic groups. So when you think about that, you can imagine the sort of richness, the complexity of the continent, how innovations need to scale and be thought about across the continent and across the various countries. And then more importantly for me personally is to say the innovations that we take from this context can have global impact. So we look at broad questions from, timely questions around how can emerging economies restart productive society after a crisis. We look at work in climate as well. What is the optimal mix of sustainable energy sources to improve water and food security, both of which are shifting over time as there's climate change. And then today I'll focus on one of the more recent questions that my team has been working on, is around what AI tools can be leveraged to accelerate discoveries that will improve global health. And really, this is really about, you have your sustainable development goals as your different targets in various potential disease areas. And they're on a certain trajectory, but from an exploratory perspective, how can technology, how can AI, if appropriate, if relevant, actually potentially accelerate the progress so that we reach those targets much more quickly, So really understanding if that is possible. So in this space, for the purposes of this talk, I'll talk about this from 2 project areas that we've been doing with, that is in part funded by the Gates Foundation and in collaboration with a number of partners across various countries. Again, we're coming from it from a technology perspective, but we really rely on that domain expertise, the local context to help inform and understand the insights that are done, and also to think about something that I guess, kind of learn on the job is this so-called journey to AI. So as much as we might think, oh, okay, AI is a great answer to X and Y and Z, and even if it is, people, the stakeholders in the ecosystem need to gravitate and understand its role, and then feel comfortable using it in making decisions and so forth. So there is like an underlying sub-theme that, kind of a lessons learned around a journey to AI. So even though it shows good promise, there's still more elements to make it real. All right, so I'll talk a bit about some work in decision support for disease intervention planning. And then I'll highlight 2 areas around that leverage techniques in the AI space around characterizing subpopulations to understand various health outcomes. So in the disease intervention planning space, I'll focus on malaria control. And to motivate this, let's start talking about the problem of malaria. So malaria, believe it or not, is like an age-old disease that's been on all the continents, I think, except Antarctica, essentially since the beginning of time. And it's the parasite that's transmitted by a mosquito, so an infectious disease. And actually at present day, every 30 seconds, believe it or not, one child dies from malaria globally. And there's more than 90% of the cases of malaria still occur in sub-Saharan Africa. So you can imagine the burden of disease. And in 2018, 400,000 people died from malaria alone. And what's very shocking about these numbers is that malaria actually can be treated with anti-malarial drugs, and transmission can be prevented with effective malaria control. So there are levers and actions that we can take to really significantly reduce these numbers. So we formulate this as decision support for malaria control. And what this is that you've got your policy and or decision makers that are looking at various targets around controlling the disease. It could be to reduce the mortality, it could be to eradicate malaria in certain regions, it could be to reduce prevalence and so on. And at the same time, they're facing their own constraints, and it's definitely around budget, supply chain, resources, and others. Now, the malaria modeling community has actually been quite active for several decades, I think even since the 1950s. So there already is a very strong community that has been developing very rich domain models that help to realize the spread of the disease, including from where eggs are laid to even where the mosquitoes come into the household or into some building. So you have this rich community that has these very complex models within the disease modeling community. And this community is looking at, helping policymakers explore the various interventions that can be performed, like around spraying, how many buildings should be sprayed in a certain region, larviciding around various bodies of water, providing nets, and there's many other actually types of interventions. So if you think about the space of all possible interventions, you can see that it ends up becoming a computationally complex space with quite a number of options. So what we did is we first looked at, okay, well, how traditionally are strategies for malaria control done? A large meeting, domain experts within the malaria modeling community, within public health, and policymakers. They'll get together, there'll be reports read and written, and they'll develop like a 5-year national strategy to control malaria with those various information. So you can imagine that, it can be inefficient in terms of getting all those people in one room in one place. And then when you develop your strategy, there's that element of, well, how do you change and adapt your strategy over time? Are you really sure that this is the optimal strategy to apply? And so those other questions sit at the background as well. So what we did is we actually said, okay, it's excellent and fantastic that we have this disease modeling community that has done a phenomenal job of creating many different models of the life cycle of malaria, incorporating various interventions that can be applied. So it turns out, the malaria domain models are rich or comprehensive. Generating samples from these can be complex. So sampling is basically representing what the model is digitally. The search space is large in terms of, the combinations of interventions. But actually, it turns out these are very well suited to AI type problems, and more specifically to the family of problems in the reinforcement learning space. So what we've done is we've proposed that the malaria model that already exists out there, we can leverage it and bring in reinforcement learning and related algorithms and methods to those models to help more efficiently explore the space, given the targets, which might change, and given the constraints and a reward function. So in this case, the models represent your simulation environment in which you might deploy a few different AI algorithms to explore that space. And this was work that we did started to kind of plant the seed on how we're going to address malaria control a couple of years ago. And what was interesting about this work, so we started by just looking at 2 actions. So those are your interventions. So we looked at 2 actions, providing nets and doing spraying. And then it's about what proportion of households in a given region should be given nets, and what proportion of households and buildings should be sprayed. And we use a reward function, which is from more of the medical economic side, which is the cost of DALY. So DALY is disability adjusted life years that have been averted due to a certain strategy or plan as your reward. And then we use an open source model called Open Malaria to test this idea. And the primary techniques in the RL space, or it's sort of like one step towards RL, are multi-arm bandit. So trying the various interventions and seeing what the rewards are. And through this work, we created this surface that you can see on the top, where on the top, the ITN, this is insecticide treated nets or nets. And then this side is the spraying. And then there's what proportion of nets and spraying can help you meet some reward. So right here where it's darkest red is considered the optimal reward. So there's an element of reframing this problem, just the general malaria control problem, into an AI problem. And there's an element of sampling and representing the space, which is taking advantage of compute, to be quite frank, in order to get this surface. And what we found is that we had, there was existing state of the art that was published where it had, here it says current intervention. Again, this is top down view. The left side is spraying and the bottom is nets. So the current intervention was what was in the literature at the time, heavily cited work. And that intervention, this is where they thought, this might be the best mix for the region that we did. So we picked a region within Kenya, calibrated the open malaria model to that region. And then there was an expert human that explored the different strategies as well and said, this is the optimal way to spray this number of buildings, spray this, provide nets to this proportion of the community. But by deploying various AI algorithms, we actually found a new region of space in which more optimal intervention strategies were existed. And so this kind of showed the promise and hope of leveraging these types of techniques in this public health domain. So from that work, we started to explore, because when you do multi-arm bandits, you're really, like I said, it's kind of a one shot of trying the actions or a set of interventions and seeing the rewards. But as I mentioned, the traditional method is like you have a 5-year timeline in which you need to develop a strategy. And yes, there's monitoring and evaluation, and perhaps at fixed time intervals, like the end of each years, you take that data and you inform or potentially change. But what was nice to bring to the community, and the AI community is obviously very clear, but to bring the two together, nice to bring to the malaria modeling community and the policymakers there, was to say you can actually look at various optimal strategies based on your constraints in time when your sequences of interventions can be deployed. And that was a shift in mindset in terms of what can be done. So knowing now that you've got this time horizon, you've got this set of decisions, it is actually for a policymaker a complex problem to make the best decision given that space of possibilities. So this is like tools that help support in that decision-making process. So what we found by applying that method is, as it turned out, in this case, our target is, or our goal was around prevalence. So reducing prevalence of the disease, of the parasite in a specific community. And then taking the single step intervention. So this is where you just pick the best based on it's essentially the previous slide. So you try a set of interventions and you pick the best reward, and you try that, over time. And then we also looked at it from a multi-step approach, which is where, on this slide, so year one actually makes year two is dependent on year one, right? The decisions that you make. So taking that as a multi-step approach, where in this case, we are looking at optimizing over the cost. And as it turned out, the multi-step intervention plans more quickly got to a lower cost and also the lowest prevalence for the disease. So this is an illuminating way to kind of look, provides an AI or even just more technological perspective as decision support for policymakers when they're looking into malaria control, to know that there's these various options and we can do things slightly differently that actually are more cost effective and can meet or exceed your targets. So our case study there, so it's just from a prototypical perspective, we worked in concert with the policymakers in Uganda, and their aim is around generating new malaria intervention programs to reduce prevalence and minimize death in Uganda. And that's their target is by 2025, drive the malaria parasite prevalence in all 134 districts down to 5% or less. Now you can start to see the power of potential AI techniques in this case, because you've got 134 districts that you're exploring. They have various environmental factors. They have various already existing burden of disease, human behavior, and many other complex factors in which exploring this space and to reach that target is a computationally complex problem, and where we see AI can actually assist the decision makers in this strategy. Complementary, we've started the similar work, if you can imagine, from a COVID-19 perspective, where you all are familiar with the different interventions from mask wearing to staying at home for school, and all of those, and potentially closures and other things. So again, having that space, but it's a brand new disease. So it's not a disease that humanity has known about since the beginning of time. It's evolving. The number of models that come out are evolving. We actually don't know directly the relationship between interventions and outcomes, for various locations across the world. So you need to know that relationship. And there are methods, we've done some as well, that are out there also in the AI space that are looking at that per location. But you can see how hallmarks of that type of problem, and even many other types of problem, including in climate change and climate mitigation, if formulated in this way, we can actually leverage some of these existing AI methods. And so just to kind of close out on this line of work, essentially we have this platform that is really around supporting decision-making with AI. And what was key about this is that we brought these AI algorithm developers together with these policymakers and make it easy for the policymakers to explore the space of possible interventions, leveraging domain models, in this case, malaria models. And one way that we've started this work was we did some reinforcement learning challenges at KDD, and with a number of AI teams, a few hundred submitting to that challenge and focusing on this as a challenge problem, which I think is fantastic from a public health perspective and a scale perspective. And then also at another AI conference in Africa called Deep Learning in Dava. So as I mentioned already, there are other application domains that can be formulated this way. And that's why we're trying to stay, we are model agnostic, and it's about bringing the model to the platform and then bringing in the suite of reinforcement learning tools and applying that to maximize the potential and the benefits of these models from the various communities. So this work is also a part of a set of discovery tools that we are providing to a number of stakeholders across the continent. So there's a few academic research institutions that are that have a study around the assessment of COVID-19 response in Eastern, Central, and Western Africa. And so this is one of the set of tools that is supporting those scientists and researchers in a number of their objectives of their study. So that's one example of the ways in which, in this case, reinforcement learning and that kind of family of methods can be used in the global health space, leveraging, in our case, we came from the perspective of Africa in terms of the data, but could scale for other diseases. Now I'll kind of do briefly two more highlights. One, so just broadly looking at characterizing subpopulations to understand health outcomes. And so the methods that are used here, well, first, the areas of exploration are in family planning and in maternal newborn child health. So in family planning, I'll discuss methods within the discriminatory subsequence mining. So it's kind of a item set association rules method plus, and then around automatic stratification. So that leverages subset scanning techniques. And I'll tell you about the different problems that were presented to us by kind of organizations on ground to address with our tools. In family planning, for example, the whole idea is that it can actually reduce the maternal mortality risk and improve child survival through proper birth spacing. And so there's this element of contraceptive discontinuation. Believe it or not, 20 to 40% of women discontinue the use of a contraceptive method for reasons that are other than the desire to become pregnant. And so this has obviously a large potential for impact worldwide, especially when it's over 214 million women who want to be able to determine when they get pregnant and are not using modern contraceptive methods. So this kind of frames the overall domain in which we engaged stakeholders on the ground. And specifically, the questions that they ask is, well, what do women transition to when they discontinue or switch between contraceptive methods? And are there any recurrent sequences of contraceptive use and discontinuation across various countries? So it's really around understanding that population. So to test even if this approach makes sense or if it works, we leverage the Demographic Health Survey, DHS, pretty well-known survey that happens every several years across many different countries worldwide. So you can request access to this type of data set. And they have over 300 surveys, more than 90 countries. And there's this element of this survey that they have contraceptive calendar data. So understanding the type of contraception that was used, and then events that might have occurred in that month. And here's a sample on the right-hand side here that about this data set. So they'll code it for every month with the timestamp. It's like one of 10 different types of contraceptive methods. And then if there was a discontinuation, there's a various types of events. Maybe there was a pregnancy, maybe it was inconvenient to use. All of these are listed on this right side. So the types of intervention or contraceptive are on the left here. Now, we recognize that this well-known data set does have issues and challenges in the data from missing data, people not reporting, imbalance in classes. And so, take those elements as important caveats of this work. But I think from our perspective, it was the potential of, again, bringing these AI methods into this domain to answer some of those questions that are now like time series related questions. So we used sequence mining methods to identify patterns that are unique to one cohort of women versus others. So sort of an illustrative example is that you might have a defined cohort on the left and a defined cohort on the right, different characteristics for each of these cohorts. And there might be a sequence of events. In this case, you're going month to month to month of what type of contraceptive use was used and was there an event that occurred. at the same time that you discontinue. So we would find patterns within different cohorts to understand the types, to understand and to characterize the types of women who were using certain types of contraceptives, when, how frequent, and so forth. And so the idea from a discriminatory subsequence mining approach is about finding what are those unique sequences of contraceptive use and patterns that were in one cohort versus another. And there's, we have a nice paper on this that came out last year that also has some elements of using LSTMs for predicting that as well. So broadly, we did a lot of exploration. So we started with looking at these 5 countries here: Kenya, Ghana, Nigeria, Ethiopia, Burkina Faso. So basically about 95,000 contraceptive calendar data for over 5 countries. And then what we found in terms of general subsequences between there, most popular were uses of injectables and then transitioning to non-use. So it kind of tells you, or it gives you a way to almost like a hypothesis around, is there an issue with injectables that are causing non-use? But you have to do the causal analysis of that and understand that, that series is coming up in this seminar as well. So we ran quite a bit of analysis looking at various cohorts. So here, for example, we're showing Kenya, and again, the numbers are the coded type of contraceptive use. So these are the sequences that, common subsequences that women use before they landed in non-use from one cohort. So the left cohort is subpopulations that stopped using the contraceptive because of health concerns. And then the right, or the other cohort, is all the remaining women, except for those who discontinued because they wanted to get pregnant. So this looked at the patterns within these populations across these countries to help give some insights on the type of use and what could be leading to discontinuation. I won't go too much detail, but this is again just more kind of summarizing this method and techniques, looking at various groups. So here, the left cohort is they discontinued because they got pregnant while using contraceptive, versus discontinued because they wanted to get pregnant. And then this is the number, the data in there. And then it kind of summarizing some of the results is that 25% of the women in the left cohort had the item set, and this is again, item set is made of the types of contraceptive patterns, had a specific item set that was unique from the right cohort. And from this, we were able to see that 3.1 times more women with this item set are more likely to be in this left cohort. So the characteristics, the covariates that describe this cohort, those types of women were 3.1 times more likely to have this pattern. Similar element on the right. I won't go into detail just for the sake of time. And so it's a way to just summarize the data across these different subgroups. So, so we had started with an exploration of providing these sort of age-old techniques with some newer variants of them to understand and characterize the behavior of patterns of use of contraceptive methods in women in many of these countries based on the interests of the stakeholders. And then we started to look at predictive patterns of use formulating it as a recurrent neural network, or LSTM. So that element, so that's in the paper that's down there. And actually we started on some causal analysis. So now that you're exploring, you've got some hypotheses, you've got some predictors, you want to understand, well, what are the underlying potential causes of discontinuation, given the set of reasons that are provided in this data set. So the last area that I'll highlight quickly in which, again, AI methods used in data sets in Africa is around maternal newborn child health. And we want to characterize those subpopulations for which there are disproportionate outcomes, whether it's, more likely to have the mom pass away, or neonatal mortality, or even on the positive side, where there's more likely to have a successful birth and the mom is healthy as well. So it was really around understanding these subpopulations of women in those two ends of the spectrum. So I'll give a small example here as to, well, first let me start with some context, but then I'll give a small example as to why it's an interesting approach. So in this space, actually 99% of all maternal deaths are in developing countries. So you can imagine the power of finding solutions and how they can impact a lot of the globe. 47% of all child deaths under the age of 5 occur within the first 28 days of birth, so essentially neonatal mortality. And then 15 times higher mortality rate for children under 5 in sub-Saharan African countries than high-income countries. And again, similar to how malaria can be treated, the majority of maternal, newborn, and child deaths are actually preventable. So in this work, working with our collaborators, they wanted to understand, can we identify subpopulations of mothers and children who are disproportionately susceptible to poor health outcomes in the MNCH space? Leveraging that DHS data set, they have other obviously variables, we started the analysis in this space. So this is just an example looking at one country. So under 5, child mortality being your outcome for Nigeria using their DHS data. So the way you want to use the common method or traditional approach from a public health perspective is to kind of look at these various covariates, where do they live, how old are they, what's their household, and to stratify the various outcomes based on these. But what it turns out is that there's only so much that you can stratify on as an individual to say, to keep all those different covariates in your head. And you might bring in bias as well. Like you might start with gender always. So in this case, here's an example of just doing some hand stratification by region, where you have 13.1% of mothers have experienced the loss of a child under the age of 5 overall. But in the Northwest region, it's obviously much higher than in the Southwest and the South regions. So we want to be able to do this, but without prescribing what covariates to look at. For example, region might not be the biggest factor. So we use methods from subset scanning to provide a tool called automatic stratification to understand vulnerable populations. And by applying this method, which I'll highlight briefly, we're able to see that the vulnerable subpopulation had characteristics, and these are the characteristics of the covariates in the data, that mothers with greater than or equal to 3 births in the past 5 years, they were in that vulnerable population who might have lost a child. And they resided outside the South region. So you can see these are the types of characteristics that were automatically found for this method. And then there's some summaries around it in terms of it represents 48% of the under 5 mortality among the members of this specific population, and that can help inform your intervention planning, given that it's such a huge proportion of the overall population. We did the same type of work for the protected population, those with good outcomes. And in that protected subpopulation, we found that mothers with 1 birth in the past 5 years were less than 40 years old and residing in a household of size 3. So these are not the same covariates. But this subgroup of individuals actually had better outcomes from the data. And all of that is published in the paper there. Just briefly, if we look at this problem, you have the set of covariants, and these are examples by region, wealth index, household size, mother's BMI, mother's age group, all these covariates. And you have your domain. For each of these domains, you have various groups of ranges. So whether you're under 20, whether you're obese, and so forth. So really the problem is like you're actually trying to look at all combinations. And of course that's computationally infeasible, but it actually can be well tuned towards some AI methods to explore that space again. So in the way that we do this is we start optimizing over these various subsets. We include and exclude certain subsets of data based on the outcomes of interest. And just in the interest of time, the key part of this family of methods, subset scanning, is to exploit a property of the optimization function, which allows for a much better calculation of exploring the space of all possible subsets by giving a score, and allows you to look for the best subsets in O(n) time. Of course, it has the trade-offs based on the scoring function. And you can find the sort of the core of those methods in earlier work shown on the left here, and then more recent work more on the analysis side on the right. And so next steps around this work is really understanding, doing some level of targeted intervention planning. You know, what are the actionable things? So if somebody is, you can't change their age. So it turns out they're 40 to 60, and that's a vulnerable group. Well, you can't change their age, but what are the actual covariates that you can change? And then how big of a change in outcome? Can they move from vulnerable to protected, for example, by changing those covariates that can change? And just to kind of wrap up here, these are the tools that we leveraged and that we contributed to, just in case you want to explore some of these methods. So AI Fairness 360, causal inference, and then this tool called WinTrack, which was around the non-pharmaceutical interventions tracker for COVID-19. And how we do this, I alluded to that a lot in our discussions, through on-the-ground collaborations and partnerships, design thinking workshops, technical presentations, and a lot of collaboration to identify and work together on these huge grand challenges. So this is kind of broadly some of the areas that we've worked in. And then I want to thank the incredible team that I work with to help make some of these interesting problems and look at them in a different way come to life. Thank you. I'll take some.
Great. Thank you so much, Aisha, for a important and critical talk. I think I definitely have many questions, and I think if maybe this time we can ask people to also put their questions at the Q&A box on Zoom. We'll be happy to look at some of them. So I wonder, related to, you mentioned some data sets that define certain use cases in in certain contexts. How difficult is it to actually gather and collect data for these use cases, and like across various geographical locations? Is there maybe some missing labels or a lot of noise or some kind of temporal considerations that come with even just collecting the data from the ground?
Yeah, that's really, really good, and obviously a very important question from the AI perspective. So some of the data that we had, are from surveys, and you can request access as long as you have ethical approval to access those data sets. So definitely, because we're in the healthcare domain, it can make things a lot more sensitive. So there are some data sets. The DHS one is one example that has been ongoing, and then you request, assuming you have ethical approval. And then sometimes we have partners that have been collecting and collating data from the studies that they've been running. And it allows us to say, okay, you had this investment on this study, you might have published a few papers on this outcome, but if we explore this rich data set, we might be able to find new insights. So you actually don't have to do another investment. And so there's an element of a value proposition there. But also there's the potential that AI methods don't find anything interesting, just as a reality. So definitely around, the data are around, there's been quite a bit of work in the healthcare space across the continent. It's really, around, what value do you bring? What insights can you bring in kind of that track record? And of course, having that ethical approval. But yeah, really good question.
Great, thank you so much. There's also a couple questions at the QA. Thank you for the amazing presentation and the meaningful work. I was wondering how to form connections with the local policy makers. How do you communicate your results, and how do they often take them? About the local policymakers is the question.
Yeah, a really great question, and it was kind of just one of those lessons learned through the journey. Well, on the malaria side, we actually had, what we're still testing and piloting an interactive dashboard that helps them to understanding what questions they ask when they make a decision around malaria control. So, moving the different levers in terms of their budget constraints, any other types of constraints, what's their goals, trying to make it, visually easy. So there's a strong UX element of the problem here for them to explore the space of possible interventions. Also, because the approach we take is that we're model agnostic, they might want to explore the interventions from different models, which may or may not conflict with each other, but to try to make that seamless. So it is really sitting with those policymakers and working to develop that user interaction based on their workflows. And it is quite a process. And how do they often take them? Sometimes well, sometimes there's an element of, we knew that already, right? But I do think it's interesting that AI can confirm kind of existing knowledge, just coming from a pure data-driven perspective. And they might not find that as valuable. So I think in terms of how do you take the results, we meet like all the time and talk through the methods, and there's always something on the ground to bring to those conversations. And so it's not that it's like a one time after 6 months you just present results, because we've learned that that doesn't go well. And even with the automatic stratification, we had a more complex algorithm. Well, it's complex in some ways, or to a certain audience, so using decision trees. And we actually said, let me go back to the way that that this community knows. They know about stratification. And then how do we kind of make the argument of AI methods starting with what they know? So that happens a lot. Thank you.
Interesting. Yeah, definitely a difficult task. There's one additional question here. This is all very exciting and impactful. Can you say more about IBM research and its focus on social impact? How many people are in the group and have this emphasis?
Yeah, so I don't think that I think social impact for us was like a given. So we were, I mean, that's the interesting perspective of working in the private sector, working for an industry research lab, which is what I wanted to do. You actually have to think about innovations that can have sustainable business model impact, right? So you actually have to have, when you prove your idea, you have to think about how this solution can be sustained. And usually that's financially, who are the right partners, what's the value, right? So there's plenty of problems. Those are like for free, about prioritizing your problems based on the strength of your organization. So in our case, it's it's going to be cloud and AI as IBM as a technology company versus other elements of a problem. So we all do social impact in many different ways. So I'd say a lot of the research scientists, which was a few thousand, contribute in some way. But again, the motivation is actually, it's much more than social impact. It's actually going to there's a business model for it, and it can be sustainable. So it's looking at the fact that the problem can actually have impact on society and add value to a company. Thank you.
Great, thank you, Aisha. So I think maybe we can, I definitely have a lot more questions, but we can also ask on the panel on Friday, which is also, I encourage everyone to attend if they have further questions, and want to thank you again for a very interesting talk. I want to thank everyone for joining us today. The next, our next talk in the series will be, so this video will be posted to our YouTube channel. You can catch all the talks, including Aisha's, which will be posted shortly. And then on behalf of the junior faculty fellows and series organizers, as well as our co-sponsor today, which is the BU's Institute for Sustainable Energy, I want to thank everyone for joining. We'll hope to see you on February 9th, which is Wednesday, between 11 a.m. to 12 p.m. Eastern Standard Time, for Francesco's Fuso Narini's talk on the role of artificial intelligence in achieving the Sustainable Development Goals. Great. So thank you. Have a good evening, Aisha, and goodbye.
Thank you.